A second wave, there needs to be a first. That's straight from the executive director of Crush the Curve Idaho, Tina Upson.
Boise in the Treasure Valley, in this area here, we haven't had COVID yet. We haven't had coronavirus in any fashion come to our community.
She tells me that Idaho's curve is growing. The worst is yet to come, and the state of Idaho needs to prepare before the fall. And that's Crush the Curve's priority.
What our real goal is to figure out a way for in the fall, when everybody has normal viruses that we all get in the fall, that all are going to look like COVID. Strep throat, influenza, ear infection, you name it. Anything that spikes a fever is going to spike the fear of COVID.
She tells me that Crush the Curve is working to address that issue, making sure Idaho remains open safely, especially for our most vulnerable communities.
But the struggle for us that's been surprising is the things that are being asked of others, wearing a face mask, for example, is so that an elderly or a less fortunate or vulnerable doesn't die. And if we can't get people to comply over that baseline message, right, then at that point it becomes a lot of noise we're making. But what we know is that we're never going to get everybody to comply. So instead, we are really concerned at Crush the Curve. It's late June. We're concerned we're not having real conversations statewide about where our testing capacity is truly at, about a priority group. We've announced 5 priority groups. We don't have capacity to test the first one.
This creates a costly position for not only our most vulnerable, but our businesses who are bearing the brunt of this financially.
We've asked them to do something impossible, quite frankly. And my concern is we're not really talking about what we need to talk about, and that is when we have an employee in my office that tests positive for COVID, then what? When we have someone at a homeless shelter that tests positive for COVID, then what? When somebody at the nursing home tests positive for COVID, then what? Not only are we not providing testing according to the governor guidelines because nobody wants to talk about that, we don't even have I haven't even heard somebody say what happens when we have a fire at one of these places. So we've been actively engaged and working.
Upson tells me that Crush the Curve just signed a contract with the state of Idaho as a rapid response team. But she says that Crush the Curve can only do so much.
These are real conversations that need to be happening, that are really need to be organized across all the major healthcare providers, the state public health, et cetera. And the clock is just like forever, ticking, and the time is not waiting.
Sarah Jacobson, CBS 2 News.
From washing your hands less to leaving the mask at home and giving out handshakes and hugs. In the midst of the pandemic, doctors fear more people are becoming less diligent with their health precautions. Some are calling it quarantine fatigue. And they say the relaxed mindset toward preventative measures is dangerous. The proof, they say, lies in the recent uptick of COVID-19 cases nationwide.
We're already seeing the results of some of these laxes in those hand hygiene techniques, not wearing face coverings in public spaces.
She says stay diligent with basic health practices that can limit the virus spread. Stay 6 feet apart from others, don't touch your face, and wear a mask when social distancing is not possible.